Today we had a very sick child come into the clinic. Dr. Molino, our head physician, had called me into the room. "This baby is dying," he said. They just came from the traditional healer. On the bed lay a baby girl in the late stages of kwashiorkor, a severe form of malnutrition that causes edema, hair discoloration, and organ damage. Molino lifted the child's shirt. Underneath, the ribs were clearly visible, as were numerous cuts and scars left by the traditional healer to cure malnutrition. An act of desperation. He pulled at the baby's stomach, which was loose like the skin of an elbow, indicating severe dehydration. "He has killed this baby," Molina whispered, shaking his head. The child lay motionless, with three nurses, myself, and Molino watching her suffer to breathe through the respirator mask. Her oxygen saturation was below normal at 80%. With every few seconds came a difficult breath. Molino turned to me and whispered again, "This is the sound of the end of life. She doesn't have the energy to breathe." When a child arrives this malnourished and dehydrated, the first thing to do is give the patient IV glucose and fluids. This girl was an extreme case with a blood sugar level that was too low to read. So we gave the child IV glucose and fluids and waited. Standing there for 20 minutes, shaking the baby when breathing had subsided, it wasn't looking good. Then I heard the faint sound of discomfort from under the respirator mask. Molina whipped out his stethoscope and placed it on the baby's chest. He looked up at me, smiling, and said, "There is hope." Within a minute, the girl had opened her eyes. Within two, she was crying. A beautiful, beautiful sound. The oximeter read 100%. 100%, Molino yelled, as he went in to squeeze the child's cheeks, beaming. Simple, life-saving procedures like this occur at Village Healthworks all the time. In this area 3 years ago, the child would have likely continued quote-unquote treatment at the traditional healer instead of visiting us, and would have died from these basic and easily preventable problems. There is so much more to do to make sure other girls like Sentia can live. Our malnutrition ward, which can hold 10 or 12 patients, only has 3 beds. Although we send mothers home with some food supplements, we don't have the needed secondary food packages to ensure continued growth. These items are simple, inexpensive, life-saving, and desperately needed. To support our work, please visit our website.